Okay, start.
Sir, the topic for my extempore is the role of WHO in nation healthcare. So WHO is an organization which is a part of United Nations organization with its headquarters situated in Geneva. Sir, WHO plays a major role in not only the national nation's healthcare, but also it helps in the helps in maintaining the equity of healthcare among the all the global nations. As far as the role of WHO in national healthcare is concerned, it helps in the standardization of the practices and the numbers number of doctors that are required per lakh of population, or the uh, standard amount of nutrition that is required by the children. Uh, the we often see that there is an unequitable distribution of health services among the all the nations of the world. So WHO uh, strives for the equity among nation, and it is also the first response organization in case of a pandemic. We saw during the COVID-19 when all the countries were in a race to hoard the vaccines. WHO was advocating the transfer of vaccine to the underdeveloped continents such as Africa, and uh, also WHO along with UNICEF makes a complete guideline for the care of child and the pregnant mothers in the developing and underdeveloped countries, so that they have better nutrition, so that they can create a better generation of people in the underdeveloped and developing nations. So overall, the role of WHO in a nation's healthcare is more often related to preventive and promotive healthcare. Uh, but for the underdeveloped country, they also play a huge role with the help of the other non-profit organization and NGOs in delivering the curative services there also. So that's the role of WHO.
Okay, like I will say, Avilas,
Yes, sir.
talking about the equity among nations.
Yes, sir.
So, do you know any initiative where WHO has taken to make India, matlab, not entire India or not all the aspect of health in India, to make any aspect of health in India equal to some developed nation, and any
So,
project that WHO has run to bring India into the some zone which where the developed countries are look.
no, so WHO actually can't directly interfere in the making of the health policy of our country, because health being a concurrent subject, it
Not
can.
policy terms, but WHO can also bring some their own initiative in all the nations. No?
Yes, sir. As far as I can recall, the polio immunization program was initiated by the WHO, which was later adopted by the Indian government. Also, WHO has been taking a keen interest in and helping India in eradicating the malnutrition problem which is prevalent in our country.
Okay. Talking about malnutrition problem, what exactly is the problem? Can you tell me?
So there are two types of malnutrition. One is acute malnutrition, and another is chronic. The chronic being the more dangerous one. In that type of malnutrition, the child suffers from a deficiency of nutrients, particularly proteins, from its birth itself. While in the case of acute malnutrition, the child suffers from a particular nutrient deficiency, through which it can develop a certain kind of disease, like xerophthalmia in case of vitamin A deficiency, or pellagra in case of niacin deficiency.
Okay, my
Uh,
question came in that if there is malnutrition, it must be a reflection of the poverty or lack of livelihood, or maybe lack of parental care or family issues.
yes,
So,
sir.
so how do you think that a health infrastructure, a good health infrastructure, or even from the help from WHO, what exactly we can do here? And how do we solve this problem? Because this particular problem is coming through many other aspect of life also.
Sir, WHO has a lot of its association with the NGOs and NPOs who can build a PPP model with the Anganwadi Kendra and the uh, primary healthcare centers, and they could monitor specific areas and identify the key areas where children are malnourished, and they could provide the essential food items and give knowledge to their parents and their families regarding the regarding the regarding their nutritional requirement.
Okay. Um, so, let's say if we want to come up with a policy for malnutrition, and you are also supposed to consider that many people are poor and they cannot earn money, but we still want that our children should not be lacking or having any lack of nutrients. So, what kind of even if you can look for innovation, what kind of innovation or what kind of policy will you suggest?
So, firstly, up to the toddler stage, that is up to 3 years, I would deploy. I would increase the number of deployment of ASHA and AWW and Anganwadi workers who can do doorstep delivery of uh, protein powder that is beneficial for infants, and also they would be providing the uh, injection they would be providing the injection for various vitamins and everything. And secondly, sir, for the school going children, I would prefer that see, most of the poor people are now receiving the free food grains from the government. I would prefer that the midday meal scheme, which is introduced in our primary school system, it should be replaced with the rather nutrient-specific diet, rather than giving only cereals and pulses to the children who are going to school. They could be given a small portion of paneer or eggs or or soya bean for that instance, so that they could they could uh, they could retrieve their nutritional requirement from their schools, and while they are at home they would have sufficiency over the carbohydrate requirement.
Okay. Uh, Tell me that where do we lack in terms of our health administration? Give me some points or give me some area where we are not able to do good, or what are the major issues that our public health infrastructure lacks to provide good healthcare to the population.
Sir, public health policy and health administration are a multifaceted issue which requires our attention in a multidisciplinary way. There are three A's to the healthcare service, that is accessibility, affordability, and availability. For the urban population, the availability is not an issue, but accessibility is, because there are not there is not enough spaces in the tertiary healthcare center for the urban population. But for the uh, rural population, there is a deficiency in terms of accessibility, availability, and uh, acceptability. Sir, firstly, the facilities that are available in the primary healthcare centers are not adequate. They don't even have a basic pathological or biochemistry lab testing devices. So secondly, the ASHA workers and the Anganwadi worker who are the basic ground level worker for the primary healthcare are overburdened and overworked. Most of the time, they have to do the documentation work of the other department and take part in the voting process or the population counting process, which affects their efficiency and uh, overall affecting the primary healthcare. Sir, secondly, I would say that there is a lack of vertical integration among all the three sectors of the healthcare, that is primary, secondary, and tertiary, due to which there is a lack of communication between the healthcare, due to which a person from the rural areas, if he has small elements like fever or typhoid, which could be treated in a week or 10 days, he has to go to a city, into a district hospital or a community healthcare center to get his pathological test done. If we deploy a significant number of phlebotomists who could just take the sample from the specified PHC and bring it to the CHC or the district hospital on a daily uh, or a by daily basis, it could save a lot of resources of the patient, as well as the government are giving the benefit to the rural population. And also, when a patient of severe ailment, when he arrives to a PHC, due to the lack of vertical integration, they don't know where exactly they need to go. They go
Okay,
to a city.
it's fine. Can you suggest me any changes in our medical education? Like, uh, it could be anything. Just consider that the way we are providing or developing the medical education. From your point of view, should we make any change in that, or should we bring something or add something to it?
Sir, as far as my understanding goes, and with the limited interaction that I have had with the doctors and other people in our organization, I have felt that there is a need to integrate the all the departments of the medical education, include a holistic treatment with the help of Ayush as well as the allopathy. And also, sir, most of my seniors who are there in the medical college, they say that the PSM subject is not given enough importance, due to which they don't have enough motivation to pursue their post graduation in community medicine, uh, thus affecting their understanding of the social hierarchy and medical infrastructure. So I believe that the integration of Ayush and allopathy should be our treatment course, and at the same time, we should also give more emphasis on the
So one thing that I could understand that you want to bring other way of treatments into the syllabus also, so that it can be holistic. What about the Ayurveda program? Should we also give allopathy medicine rights to Ayurveda doctors?
Sir, actually, I would not be in support of that, because allopathy is that branch which requires a complex understanding of the pharmacology, pharmacokinetics, and the various side effects that emerge out of that medicines, which I think involves a complex understanding of 2 to 3 years. Uh, if the government can provide a 2 or 3 year bridge course to the Ayurveda students, since they have their basics clear in physiology and anatomy, so I think after a 2 to 3 years of a bridge course, they can be given a status equal to the allopathic doctor. But regardless, surgery is a part which should be kept away from the Ayurvedic doctors because it requires a lot of precision and has a lot of risk involved
But
in it.
Ayurveda was the part of sorry, surgery was the part of Ayurveda also. So the ancient Ayurveda that we know had a lot of surgical procedures written there. So we can also revive them with the help of allopathy. We can make them perfect if it was risk oriented.
If yes, sir, for that both the eminent doctors of both the department, that is Ayurveda and allopathy, would have to come together and discuss how that could be integrated. But
Okay. Yeah. So I mean, last question for you. You have already qualified many exams that you have written in your basket, and you might get also admission in PhD programs and other science or research field. And we see there are a lot of people who have got fame, name, and they have created a good career in research. But public health is something where you won't see too much people rising up to that fame or that kind of achievement. So, what it is there which is inspiring you to
sir,
become a professional?
sir, firstly, public health is also a domain which can be really lucrative as a career because right from working at the ground level of the public health operation, we could escalate up to the planning commission of WHO or in the Niti Aayog, helping uh, the health sector through our ideas. But I feel, sir, my interest has always been in the administrative part and planning and management part. I have taken keen interest in organizing various health camps and other programs which have uh, uh, in which I have in which I have managed the patient and the doctors at a small scale only due to our limited budget and everything. But I feel my interest has always been in the public health sector, and I want to be a part of the development at the grassroots root level. That's why I want to pursue
ओके
this
ओके
course of public health.
ये तो बहुत अच्छा था यार आज तो मतलब बहुत ही बढ़िया तुमने बोला एक्सटेम्पोर थोड़ा वैसा अप टू द मार्क नहीं रहा बिकॉज पहला हाफ तो पूरा एक्सटेम्पोर का यू जस्ट रिपीटेड द सेम लाइन दैट इट कैन बी वेरी यूजफुल और इट इज पार्ट ऑफ ह्यूमन
Uh,
मतलब इट वाज नॉट रिक्वायर्ड मतलब हम लोग सब जानते हैं कि डब्ल्यूएचओ किसका पार्ट है ना तो मेनली द रूल था तो उसमें एक तुमने बताया कि स्टैंडर्डाइजेशन ऑफ प्रैक्टिस है उसी को ओ यू एक्चुअली मेक द फोर्थ पॉइंट गाइडलाइन फॉर चाइल्ड एंड मदर चलो ठीक है चाइल्ड
सर
एंड
एक पॉइंट मिस भी हो गया सर, हम लिखे थे यहाँ पे कि वन हेल्थ के बारे में कोट करना है, क्योंकि वन हेल्थ जो है वो WHO ही लेकर के आया था,
ठीक है
उसको मैं कोट करना ही
तो
भूल गया।
बाकी इक्विटी अमॉन्ग नेशन तो ये तो हो गया कि सबके लिए हो गया तो हम लोग तो एक नेशन की बात कर रहे थे ठीक है वो भी पॉइंट सही है फर्स्ट रिस्पॉन्स ऑर्गेनाइजेशन वाला भी पॉइंट सही था बट मुझे लगा कि नेशन स्पेसिफिक कुछ तुमने बहुत वो बताया नहीं मतलब टाइम टू टाइम दे प्रोवाइड लोन नॉट लोन मतलब मेडिसिन कहीं से कलेक्ट करके या वॉट एवर द रिसोर्सेज दे हैव द डॉक्टर्स वो बहुत सारे डिजास्टर के टाइम में बहुत हेल्प प्रोवाइड करते हैं
यस सर।
हाँ और जैसे किसी कोविड टाइप की बीमारी आउटबर्स्ट होती है तो उस टाइम पे भी दे एम्प्लॉय देयर टीम है ना टू दैट प्लेस तो इस तरह का रिसर्च भी मतलब कंटिजेंसी पे रिसर्च भी करते हैं पर्टिकुलर सिचुएशन में तो डब्ल्यूएचओ का बहुत सारा रोल हो सकता है बट यू कुड नॉट स्पीक मच तो उसमें थोड़ा तुम्हें कम मिलता है ना
राइट सर।
उसके बाद इंटरव्यू में इनिशियली मुझे लगा कि एनालिटिकल थोड़ा सा कम चल रहा है मतलब आइदर यू आर कोटिंग बड़ा जेनरिक थिंग्स कम्युनिकेशन पे अच्छे नंबर मिले सब्जेक्ट नॉलेज पे भी ठीक था बट लेटर उस क्वेश्चन में यू टर्न द एंटायर थिंग्स इन योर फेवर जब आयुर्वेदा और उसकी बात हो रही थी है ना द ब्रिज कोर्स वाज अ वेरी गुड थिंग है ना which could be a formally trained matlab doctors can be formally trained and especially when you talk ki they are already trained in physiology and many other बेसिक कोर्सेज अपॉन विच फार्मेसी की नॉलेज दी जा सकती है उनको, एंड दे कैन प्रेस्क्राइब फॉर सर्टेन डिजीज एंड और सर्टेन काइंड ऑफ। तो ये ठीक था। ओवरऑल इंटरव्यू में तो 90 के आसपास मिल जाएगा तुम्हें, और वो एक्सटेम्पोर जो होता है वो 70 या थोड़ा 70 से एक दो नंबर कम भी हो सकता था। बट अब तक के जितने भी इंटरव्यू हुए उसमें सबसे अच्छा है ये तुम्हारे।
फिर एक्सटेम्पोर पे थोड़ा सा और करेंगे सर। मतलब मैंने लिखा था वन हेल्थ, मैंने लिखा था, बट मैं
हाँ।
बोलना ही भूल गया। अभी वन हेल्थ नया इनिशिएटिव है, उसका नागपुर में नया उन्होंने कैंपस भी बनाया है।
अच्छा। नहीं
हाँ
देख,
डब्ल्यू एच
और ना कुछ तुरंत सोचना चाहिए, मतलब पांच छह, जबकि रोल तो बहुत सारा है ना। डब्ल्यू एच ओ इज अ टू बिग ऑर्गेनाइजेशन है, टू इम्पोर्टेंट, टू